Today, as we resume our Well Woman Wednesdays, I am Dr. DeShawn Taylor. I'm a board-certified gynecologist and family planning specialist coming to you from Phoenix, Arizona. And today, I want to talk about intrauterine devices for birth control. And so I want to give a moment for notifications to go out that we are live so that people can join. We are hopefully live on Facebook, Instagram, and our new YouTube channel. And so we're excited to be able to get good information out to people in different places where whatever channel, whatever social platform you're following. And so feel free to ask any questions as we're going along. I have people monitoring the chats for me so I can try to incorporate any questions that come up during the discussion. And so again, I am Dr. DeShawn Taylor. I'm a gynecology and family planning specialist, and I'll be talking about intrauterine devices for birth control today. And so when I have conversations with people about their birth control options, I always first ask people, what have they used? What are their interests? And whatever they are interested in, I definitely want to validate that and discuss that. But then I always want to discuss birth control in the context of all of the available methods that are available here in the United States and what are the most effective. And so I like to think of intrauterine devices as forgettable birth control. It's there, it's working for you, you don't have to think about it. It's just as good as permanent sterilization, except it's not surgery and it's not permanent. And so let's get into this. There are two types of IUDs. There is hormonal and non-hormonal. And from the hormonal standpoint, there are a few different options, and they pretty much all work the same. So I'm not going to go into specific detail about the name of a specific brand of hormone-releasing IUD because they all work pretty much the same. The difference is just the length of time that they were approved by our Food and Drug Administration to have contraceptive effect. And then we have our non-hormonal IUD. And that one I'm going to go with first. So the non-hormonal IUD has copper in it. And these are T-shaped devices. On the copper one, there's copper rolled along if you imagine a T, you'll have the crossbar and then a tail, if you want to think of it that way. And so there's copper on the crossbar of the tails. And so the copper has several functions. It incapacitates the sperm, so they don't function well. They can't swim. If they happen to meet up with the egg, they cannot undergo the reaction that happens to actually fertilize the egg. So that's one way that it works. The other way it works is that it creates this kind of hostile environment in the uterus, which makes it not a good place for a pregnancy to implant and grow. So think about our natural menstrual cycle. And what happens is that the lining of the uterus builds up in order to prepare a nourishing environment for a pregnancy to implant and grow. And so with this IUD in place, that disrupts that mechanism. And so it's not a nice environment for a pregnancy to implant and grow. So should a fertilization happen to occur, there's not any really nice, fluffy endometrial tissue for it to attach onto. So it kind of just passes through. Another thing that it does is because the copper kind of diffuses out, it's in the uterus, it goes into the tube, then it also decreases the activity of the tubes. So becoming pregnant is like a very kind of well-oiled machine, so to speak. The sperm already has to be hanging out in the tube, waiting for the ovulation to occur and the egg to drop into the tube so that fertilization occurs right there. And then some activity is happening and growing as it's making its way through the tube down into the uterus to drop an implant. So because of the effect of the copper on the motility of the tubes, then that also kind of messes with that timing that's required for fertilization and implantation to occur at the appropriate stage. It also can damage the the egg too. So there are just all of these different factors that need to be really, really almost perfect in timing that this IUD disrupts. Now, you're still cycling, you're still having your period, and so neither IUD stops that process. Now, with the copper IUD in place, you can have a bit more cramping with your period. You can have a bit of a heavier flow. You can have a longer flow. And so I do not recommend this IUD with people who already have painful or prolonged or heavy periods because it can make that worse for you. Now, in general, if someone has a generally light period, only lasts for 3 or 4 days, generally taking ibuprofen at the first start of the period for the first couple of days definitely decreases the pain and flow related to that. And so that's the copper IUD. Now I want to talk about the hormone-releasing IUD and how, again, that's a T-shaped device. But in this device, on the tail, there's a reservoir that holds the hormone in it. And so the hormone, a certain amount of the hormone is being released from the IUD into the uterus every day. And so what that effect does is it makes the mucus of the cervix really thick. It literally creates a barrier. Imagine a wall at the opening of the cervix where the sperm cannot enter. And so if the sperm cannot enter the cervix to swim up and hang out at the tube waiting for ovulation and fertilization to occur, then that is not going to happen. So that's one of the main mechanisms of action of the hormone-releasing IUD. And so the other aspect of this is that remember that I mentioned that during our normal cycle, the lining of the uterus is building up so that you can prepare to nourish a pregnancy if it implants. And so when you have this IUD in place, it really thins out the wall of the uterus. And so there isn't that really nurturing environment for a pregnancy to implant and grow. And it is because it does that to the lining of the uterus, then people are guaranteed a lighter period. And then there's a percentage of people who don't have a period at all. And it's absolutely fine to not have a period with the hormone-releasing IUD in place. So you are cycling through your normal menstrual cycle where estrogen levels are going up, progesterone levels are going up, and then you ovulate, and then you don't become pregnant, and then hormones start to drop, and then you would have a period. And so with the copper IUD, you have the period. But with the hormone-releasing IUD, because you don't have a lot of the lining of the uterus that built up over the cycle to shed, then that's why people don't have very much of a period or any period at all. And so both of these are very, very, very good contraceptives. The copper IUD is FDA approved to work for 10 years, but it actually works for 12. Research has shown us that. And then the hormonal IUDs work anywhere from 3 years to 7 years. And so they have to be inserted by a trained healthcare professional, and they also need to be removed by a trained healthcare professional. So people often are concerned about side effects. And so at the time that the IUDs are inserted, there is some discomfort related to that, some cramping, some pressure that generally resolves. There are some mild bleeding that occur for a few days after the IUD is inserted. And I will say that for the first 2 to 3 months of having the IUD in place, sometimes it can be a bit crampy, spotty here and there as your body's getting used to the IUD in place. And so I always tell my patients, give it some time, give yourself a few months to kind of settle into it. And then at that point, if you're still having concerns and want it removed, then it's reasonable. I don't believe that we should ever, refuse to remove people's birth control devices. Our goal is to provide accurate information and give you the birth control that meets your needs. And if it turns out that you thought you wanted an IUD and it didn't meet your needs, then it should be removed. But also understanding that your fertility returns immediately after that IUD is removed. There is no delay to return to fertility. You can become pregnant immediately once the IUD is removed. And so if you're not planning pregnancy, then you do want to get started on another method. And so the additional side effects. So again, I mentioned that with the copper IUD in place, you can have a prolonged period, a heavier period, and more cramps with the period, and that's generally resolved with over-the-counter ibuprofen. And with the hormone-releasing IUD, Again, some people are concerned about the changes in the period because people are reassured when they see their period every month as a sign that they're not pregnant. And so again, having some spotting here or there, or not having a period at all, for some people is a concern, and that we talk through that in the consultation. Now, there is a possibility that at the time that the IUD is inserted, that an infection could develop. And so I generally see people back in about 6 to 8 weeks to make sure they're doing okay. Another thing that can happen is the IUD can partially come down or completely out of the body. And so that's called an expulsion, either partial or complete. And so there are different guidelines that different types of providers follow. I personally like to see my patients back in about 6 to 8 weeks to check the placement and make sure that they're doing okay. Now, there are a couple of other things that I talk about a lot with patients. And there is a string attached to the tail of the IUD. And so that string hangs out through the cervix so that whenever you have a pelvic examination, the person examining you can see that you have an IUD in place. And so that's important because when it's time for it to be removed, that string is grasped and given a gentle tug and the IUD comes out. Now, there is a risk that at the time that the IUD is being inserted, that the instrument is pushed a little bit too far. It can kind of go into the wall of the uterus or go through. That's called a perforation. That is not very common, but that is how the IUD can get outside of the uterus. I know a lot of people read things and they find, the IUD migrated up to other areas of people's bodies. If the IUD is inserted properly, which in most instances that happens, there is no way for the IUD to go but out, down and out of the cervix and through the vagina. And so that's how it is in life. You hear the most about the bad experiences, and when people are satisfied with what they have, people don't feel compelled to go out and tell the public that they're happy. And so, when you do your own searches on these things, you'll find these stories, which I definitely don't want to discount that they happen, but that's how the IUD gets out of the uterus into other parts of the body, because that generally has probably happened at the time that it was inserted. Another concern that people have is the strings. Will the partner feel the strings? So I will say that initially when the IUD is inserted, the strings are more firm. And over time, they will absorb moisture from your body and they will soften. And at that point, when they soften, then they'll kind of roll up underneath the cervix. And so I've had patients concerned that the IUD fell out because the partner doesn't feel it anymore. And so I reassure them that we don't want the partner to always feel the strings. And so we want to trim them at a length where once they soften up, they're just going to roll on out of the way and not be noticeable, but still visible, so that when it's time for us to remove it, that we can grasp the strings and remove it. Occasionally, you'll have a provider cut the strings too short, and so they'll roll up into the cervix. And so now you have these tiny little things poking out the cervix, and that's problematic with a lot of partners. And so I've had patients, I've had conversations with people, because I personally trim them a bit longer, where they've had their IUDs removed because of that phenomenon, where it was just always poking out at the partner, and that's when the strings get cut too short. And so for the most part, it's there, it's working for you. You're not thinking about it. Your partner doesn't notice it, and you don't have to think about it until you want to become pregnant, or you've come up to the time where it's time to remove it and maybe reinsert another IUD or another method of your choice. And so cost. The IUDs are very expensive. These devices cost anywhere from $800 to $900, and so most insurance plans will cover it. It really depends on your insurance plan if there's any cost sharing to you for that. There are some programs for uninsured people for the hormone-releasing IUD. One of the manufacturers there has a program. And then also at my sister nonprofit, Desert Star Institute for Family Planning, we have a program where we provide hormone-releasing IUD for uninsured people as well. And so definitely, if you want to learn more about that for yourself or for someone that you care about, just visit www.desertstarfp.org and learn more about our IUD program, and go ahead and apply. And we'd love to be able to provide your forgettable birth control for you. Now, the copper IUD, I have not seen programs out for this one. I've gone to the manufacturer's website, and there's an option for people to sign up and make payments toward the IUD, and then it would get sent out. And so that's pretty much what's available there. There aren't any programs to offset the cost of the device for uninsured people. Hopefully something like that will come down the line. As it relates to the services that my nonprofit provides, as we are able to raise more funds, we do want to build out the forgettable birth control that we are able to provide to uninsured people through our programs. And so, again, I want to say a little bit about removal. And so, for the most part, all that's required is grasping the string and then with an instrument, giving a gentle tug, and it comes out. Now, there are instances where the IUD can become embedded. And what that means is it's stuck in the wall of the uterus. That does not happen commonly, but when that does happen, then there needs to be some additional effort made by a trained provider to remove it. And so sometimes it requires some ultrasound guidance and use of additional instruments to remove it in the office. And then in rarer cases, it requires going to the hospital, to the operating room to have it surgically removed. And that sounds very scary and traumatic, but again, those are really outlying cases. Most of the time, the IUD is able to be removed easily and quickly in the office. And so I hope that this information was helpful to you. If you've been considering getting an IUD for your birth control, it's definitely worthwhile. And if you're having trouble with birth control, number one that you have to think about every time you have sex, like a barrier method, like a condom or diaphragm, and you want to move along the spectrum of uncoupling your birth control with your sexual activity, then you definitely want to have a conversation with your healthcare provider about all the different methods available to you. And if you want forgettable birth control, then the IUD is one of those options. And that's all I have for today. You guys have a wonderful rest of your Wednesday and week. And I'll see you in a couple of weeks. We are now doing the second and fourth Wednesday of the month. You guys take care.